You know that moment? You open the medicine cabinet and you're just staring at this collection of bottles, boxes, and tubes. Ever wonder what the real story is behind all of them? Well, let's find out.
I mean, it's kind of mind-blowing when you think about it, right? How does that tiny little pill you just swallowed know to go straight to your headache? Or how does an antibiotic figure out which bacteria to fight? That's the mystery we're diving into today. So you might think it's just a random jumble of different drugs, but believe it or not, there's a real system to all this. And to really get it, we've got to wrap our heads around two kind of nerdy but super important ideas. They basically explain the entire relationship between a medication and your body.
All right, first up is a mouthful, pharmacokinetics. But don't worry about the name, just think of it like this. It's the drug's grand adventure through your body. From the second you take it, your body starts to process it, absorbing it, distributing it, breaking it down, and finally showing it the door. Simply put, it's what your body does to the drug.
Okay, and on the flip side, we have its partner, pharmacodynamics. If kinetics was the journey, then dynamics is the big finale, the destination. This is all about what the drug actually does once it arrives, the effect it has. So this is what the drug does to your body.
And this lays it out so clearly. Pharmacokinetics, what your body does to the drug. Pharmacodynamics, what the drug does back to your body. It's a two-way street, a constant conversation. And the craziest part? Both of these things are happening at the exact same time.
Okay, so enough with the fancy pharmaco words for a minute. In our everyday lives, we actually group drugs in much simpler ways. First, by what they do, their therapeutic use. An analgesic, like ibuprofen, is for pain. Easy enough. And second, we group them by how you get them, their legal status. Can you just grab it off the shelf, or do you need a prescription?
All right, so we've got the classifications down. But that just brings up another question, doesn't it? Why do some come as pills, others as shots, or even patches? Let's get into how these things actually get into our bodies to do their job.
Exactly. It's not just to give us options. Every single one of these methods, what the pros call a route of administration, is chosen for a super specific reason. It's all about strategy.
And this chart really breaks down the trade-offs. Taking a pill is super convenient, right? Easy for things you take every day. But it's slow to kick in. An IV, though, boom, the effect is immediate. Perfect for an emergency. But you're not exactly going to give yourself an IV at home. It's all a balance.
And oh, it gets way more interesting than just pills and shots. You've got drugs that dissolve under your tongue for lightning-fast absorption. Then there's stuff you breathe in, like anesthetics that go right to work. And of course, topical creams that do their job exactly where you apply them. It's all about one thing: getting the right drug to the right place at the right speed.
Okay, so this is all pretty cool, but it begs a really big question. How do we actually know any of this stuff is safe? Well, that brings us to the whole system of rules and regulations that's in place to protect us.
It all kicks off with something called drug standards. The best way to think about it is like a super strict recipe book for every single medicine. Big official guides spell out exactly what needs to be in a drug and how it has to be made. This is all to make sure what you're getting is pure, powerful, and most importantly, safe.
And let me tell you, the journey a new drug takes to get to your pharmacy is, well, it's an epic. We're talking years of intense clinical trials. Then, an agency like the FDA goes over every last bit of data with a fine-tooth comb. If and only if it passes all those tests, it gets approved. And even then, they don't stop watching it. It's monitored for years after it's on the market, just to be sure.
So once a drug is approved, how does it physically get into our hands? Well, it varies. Some places have a government-run system, others have a private system with pharmacies you'd recognize, and a lot of places, as you can see here, actually have a mix of both. The end goal is always the same, though: get the medicine to the people who need it.
Look, this whole system is fantastic, and it's there to keep us safe, but at the end of the day, who's the most important player on your health team? It's you. So let's shift gears and talk about some simple tools that can help you become the expert on the medications you're taking.
We've all done it. You type a drug name into a search engine and end up down a terrifying rabbit hole. Don't do that. Go straight to the reliable sources. Government websites like FDA.gov are solid gold. There are also amazing online databases and even apps for your phone that basically give you a pharmacist's brain in your pocket.
Okay, that's great, but how do you keep all this info straight for the 2 or 3 or 5 different things you might be taking? I'm going to let you in on a little secret weapon that nurses and doctors use all the time. It's simple, but it's a game changer. It's called the drug card.
And seriously, it could not be easier to make one. All you need is an index card or even just the Notes app on your phone. Jot down the name of the drug, what it's for, common side effects, and most importantly, any special instructions, like take with food. Check this out. Here's a perfect example for something we all know. Ibuprofen. See that? In 4 little lines, you've got the most critical info right there. Now just picture having one of these little cards for every single thing in your medicine cabinet. Talk about being in control. That is what real patient empowerment looks like.
So from now on, when you look at that little bottle in your hand, you'll know the incredible story behind it. It's not just a pill. It's a product of amazing